You might not be familiar with the name flunitrazepam, better known as Rohypnol, but it's one of the most common date rape drugs. Rohypnol is often involved in drug facilitated sexual assault, undetectable when slipped into alcohol. In this video, we will discuss some of the side effects of Rohypnol, what a Rohypnol overdose looks like, addiction and withdrawal, and how you can protect yourself. So, what is the date rape drug known as Rohypnol? The actual drug name is flunitrazepam, and it belongs to a class of drugs known as benzodiazepines. This drug is a central nervous system or CNS depressant. You can find it across Europe and Latin America, where it's sometimes prescribed to treat severe insomnia. In the United States, Rohypnol has yet to be approved by the Food and Drug Administration or FDA for medical use. It's because this drug is a central nervous system depressant that it's often used to help facilitate date rape. Shockingly, Rohypnol is 10 times more potent than Valium. The Office on Women's Health reports that almost 11 million women have been assaulted while drugged with substances like Rohypnol. Note that drugs and alcohol are frequently involved in cases of assault. According to one survey, about 75% of men and more than 55% of women involved in date rape incidents had been drinking alcohol or using illegal drugs right before the attack. More specifically, a 2015 study estimated that about one-third of sexual assaults involved date rape drugs. Now, the effects of Rohypnol. In hampering your central nervous system in high doses, Rohypnol can induce severe sedation. Other side effects of Rohypnol include reduced blood pressure, slurred speech, mental confusion, muscle relaxation, and impaired judgment. It can be dropped in liquid and will dissolve easily, rendering the victim incapacitated and making them vulnerable to coercion and assault. While it depends on the dosage, some signs of a Rohypnol overdose, especially when combined with alcohol or other illicit substances, include severe sedation and a slowed heart rate. The victim can also lose consciousness and experience respiratory depression, which can be fatal. The effects typically kick in within 15 to 20 minutes and can last for as long as 12 hours. While it's a prevalent date rape drug, some individuals abuse Rohypnol simply to achieve a euphoric high, where they experience reduced inhibitions and extreme relaxation. For example, older research once stated that about 2% of high school seniors in the US had used Rohypnol within the last year. This club drug is referred to by many street names, including the Forget Me Pill, La Rocha, the Lunch Money Drug, Mexican Valium, Roofies, Ruffies, Rofies, and Wolfies. So, is Rohypnol addiction real? Yes, you can become physically addicted to Rohypnol if it's abused over an extended period of time, making withdrawal challenging. If an individual has been abusing Rohypnol pills and decides to get sober, they might experience withdrawal symptoms, including insomnia, anxiety, irritability, headaches, mood swings, nausea, fatigue, and weight loss. These withdrawal symptoms can be dangerous if the individual doesn't stop their drug abuse gradually. Yes, going cold turkey can be dangerous. A medically supervised detoxification process is the safest approach to Rohypnol addiction treatments. If you're looking to stop abusing club drugs, don't do it alone. Now, how can you tell if you've been slipped Rohypnol pills in your drink? Will you see Rohypnol fizzing in your drink? Should you look for powder at the bottom of the glass? Unfortunately, once crushed and dropped in liquid, Rohypnol tablets are nearly undetectable. However, certain pills, which are green on the outside and blue in the center, will turn light colored drinks blue. So, what can you do if you think you've been poisoned? If you're experiencing the adverse effects of Rohypnol, like slurred speech or sedative effects, or think you've already been sexually assaulted, it's crucial to seek medical attention immediately. In the case of a potential poisoning, call 911 or have a friend drive you to the emergency room. If you think you've been assaulted, avoid changing your clothes or showering, as these often serve as evidence of crimes committed by sexual predators and can offer insight into the events surrounding the assault. U.S. Drug Test Centers offers Rohypnol drug testing along with screenings for other common date rape drugs, such as gamma hydroxybutyrate or gamma hydroxybutyric acid or GHB and ketamine. We have more than 2,000 locations nationwide, so we can guarantee the most convenient collection option for you. If you suspect you've ingested a date rape drug, time is of the essence. Don't wait. Take action immediately. Now, here's how to protect yourself against date rape. In a perfect world, we don't have to prepare ourselves for Rohypnol abuse. However, this illegal drug makes its way into bars, clubs, and restaurants around the nation. We want to stress that the victim is not to blame. However, we must look out for ourselves. Here are a few tips to stay safe. Always watch your drink being prepared by the bartender. Never leave a drink unattended or accept beverages from strangers. If you do set your drink down, get a fresh one. Never revisit an old drink. Employ the buddy system wherever you go, including especially bathrooms and parking lots. Hold your drink so that your hand covers the opening, protecting the liquid inside. Make sure you have a backup mode of transportation like Uber or Lyft if you and your friends are unable to drive. And avoid shared punch bowls, which can easily be poisoned. Rohypnol use can be dangerous at best and deadly at worst. If you think you've been poisoned with this date rape drug, seek medical attention immediately and locate the closest drug testing center to you at U.S. Drug Test Centers.
For more information about U.S. Drug Test Centers, give us a call at 866-566-0261, or you can sign your company up for membership services, order a drug test, or a policy manual right here on our website 24/7.